I am student nurse Angelica Contreras from BSN 1 11C Group 10. Today, I'm going to conduct a skin assessment. A thorough skin assessment can give us information about potentially serious diseases, especially to older adults, as they are vulnerable to skin breakdown. To start off, I need to prepare all the things that I need. So I will need a good source of light, pen light for a better visualization, ruler to have a more accurate measurement, alcohol to sanitize ourselves, sterile gloves to avoid cross-contamination of microorganisms, and lastly is the patient's vital chart where the vital information of the patient is recorded. Prior to the assessment, I need to close the door and fix the curtain to provide privacy to the patient. So, before meeting the patient, we need to do a proper hand washing to deter the spreading of microorganisms. Hi, good morning!
Hello, good morning.
I am student nurse Angelica Contreras. Can I hold your hand to check your wristband? Okay, thank you. Can you please state your first name and last name to me?
My first name is Ivy and my last name is Salam.
Okay, and your date of birth?
August 19, 2002.
Okay, thank you, Miss Ivy. And how would you like me to address you?
You can just call me V.
So, V, are you okay with the current language we're using right now? Or are you comfortable speaking Tagalog or Bisaya dialect?
It's okay.
And the room temperature, is it okay with you?
Yes, it's also okay.
Okay. So, do you know what are we gonna do today?
It's to miss for checkups.
So, today I'm gonna assess your skin, hair, and nail to check for any open wounds, lesions, or any scars that will give us insight of your current health situation. So, this will involve me touching some certain parts of your body. Is that okay with you?
Yes, it's okay.
Okay, so rest assured that all the information that will be gathered is completely confidential between me and the attending physician that I will recommend to you, okay? Okay, so if you have any concerns or questions during the assessment, don't be shy to ask, okay? So before we start, I'm gonna ask some questions about your past health history and other info that will help us figure out your situation. So, V, are you experiencing any current skin problem like rashes, lesions, or anything that you notice?
Well, I've been itching for past 4 to 5 hours. And I think it's not getting away.
And when did this itching started?
Earlier this day, just after we had our lunch at my uncle's seafood restaurant.
Okay, is there any particular area where does it totally actually itches? Does it radiate to any other part of your body?
Well, at first it starts from my neck.
Okay.
Then it spread throughout my arms. And after realizing that it spread through my arms, I found it hard to breathe.
Breathe, yes. Okay. And how long does this itchiness last? Does it stop then recur again?
It doesn't particularly stop. It's just that the itchiness will just visible and
Yes.
and time by time it gotten worse.
Okay. Can you tell me how bad is it? Does it bother you?
Yes, it bothers me a lot. Also from my work.
Okay. So, are there any relieving factors or anything you do to minimize the itchiness?
Actually, it's my first time experiencing this thing, and
Yes.
it's just that my mom just put some lotion to put some first aid on it to ease the burning sensation, and it just lasts for a couple of minutes. So that's the time we decided to go here.
Okay. What other symptoms occur with it? Does it bother you or does it affect you?
Aside from the itchiness, I find hard to breathe, and I
Yes.
feel like a little bit dizzy, and I feel nauseous and feel like vomiting at all.
Okay. Do you have any other diseases like asthma, hypertension, diabetes?
As far as I know, I don't have those kind of diseases.
Okay, how about allergy? Are you allergic to any foods or medications?
No, I'm not.
Okay. Can you tell me what is your typical day? Do you spend long periods of sitting or lying down in one position?
Well, it's nothing much. Just wake up in the morning, and then attend my online class.
Yes.
So approximately 8 to 12 hours, I'm mostly sitting. And onto my leisure times, I just read mangas and any
Go on.
any books. So I'm just lying down.
Okay. Okay, that's all.
Yes, that's all.
Okay. Have anyone in your family had a recent illness like rash or other skin problem or skin cancer?
No, there is none of them.
Okay. Now that we are done asking some question to the patient, we need to take her vital signs. So, let's just assume that we have already taken her vital sign. Okay, so now we are done. I'm going to assess now your hair, nail, and skin. Do you have any concerns or you want to do anything before we start?
No, there is none.
Okay. Can you please remove all the jewelry that you're wearing or the accessories that you're wearing? So, I'm going to start from your head down to your toe. But first, I'm gonna wear a gloves to further assess some areas, okay? So, skin color can reflect a patient's overall health and is an important part of assessing skin breakdown and wound healing. Generally, I see that your skin is consistent all over and I don't see any unusual discoloration. Now I'm going to check your head and hair. So can you please look down a little bit forward, please? Thank you. So the shape of your head is round and there are no tenderness upon palpation. Now, so the color of your scalp is lighter than your complexion and it is moist. So I don't see any lesions or lice or any dandruffs. And the color of your hair is black. It is thin and smooth. So your hair is evenly distributed. Now, can you please tie your hair? I'm gonna look at your face. So, V, I'm going to touch your face, okay? So, I noticed that there are 3 moles here in the upper left corner of your forehead. And the borders are regular and asymmetrical. It is about 1 centimeter. So I'm gonna check your ears. So I don't see any ear piercing. Now, can you smile for me? So, there is a slight asymmetry in the fold, but it is normal. Now I'm gonna check your eyebrow. So it is color black and evenly distributed. It is also in line with each other. Now I'm gonna look at your eyes. So it is evenly placed and in line with each other. Now I'm gonna look at your cornea. So I can see that it is smooth and clear. So overall your face is symmetrical. So now I'm gonna check your skin turgor. It is important to check the skin turgor of the patient because it is often used as a way to check the dehydration or the fluid loss. I'm just gonna pinch lightly your skin on top of your collarbone, okay? Okay, so I can see that it is elastic because it snaps rapidly back to its original position, which means it is good because it means you are well hydrated. Now, can you show me your hands like this? Okay. So it is warm. Your skin is dry. And I can see some redness and small bumps. Now, let me see your hands. So, it is clean and I don't see any clubbings or abnormal findings. Significant irregularities in color, shape, and structure may point to underlying problems or trauma or infection. Other hand, please. So, capillary refill is good. Now, I'm gonna check your lower body extremities, okay? So, now I'm going to touch your legs. Is that okay?
It's okay.
Okay, so skin lesions are very common and often appear as a result of localized damage to the skin, like sunburns or contact dermatitis. Although most skin lesions are benign and harmless, some of them can be malignant or pre-malignant, which means they have the potential to evolve into skin cancer. Other side. So I don't see any lesions, any open wounds or scars. Now I'm gonna press your foot, okay? So I can see that there is no edema present. So now we are done. So V, I'm just gonna summarize all the things that you've told me today and what I have observed during the assessment. So you have been itching for the past 4 to 5 hours with nausea, dizziness, and difficulty of breathing. Is that correct?
Yes, that's right.
So this started after you have taken your lunch. So this might be caused by an allergy from something you've eaten at your uncle's seafood resto. So the rashes or the redness and small bumps are symptoms of it. So I advise you to limit seafood intake, okay? So most people just take cetirizine to aid allergies. But I advise you to have a prescribed medication from the attending physician that I will refer to you. So generally, your skin is consistent all over. There is no any unusual discoloration. Hair and scalp is good. Hair is evenly distributed. Your face is symmetrical, and I noticed that there are 3 moles in the upper left corner of your forehead, which is about 1 centimeter. So your skin is dry and there are some redness and small bumps. So there are some redness and small bumps in your neck and in your arms. And your nails are good, they are clean. I don't see any clubbing. The capillary refill is also good. So I also don't see any lesions or any open wounds or scars in your upper body extremities and lower body extremities, and there is no presence of edema. So, okay, do you have any concerns or questions or something you want to add up?
No.
Okay, so thank you for your participation and cooperation for answering all my questions. So, we need to sanitize our hands, so we have an alcohol here. So I'm going to head up now and give this to the attending physician that I will refer to you, okay? Okay, so thank you.
Thank you.